I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands, turn around now and dance, dance, dance. I just wanna have fun, clap my hands.
Hello,
turn around now.
hello. How's everybody today? Not tired yet? So my name is Dr. Zandile Spengane. I'm a dermatologist. I work in Ranabosch Medical Center. I'm from the beautiful province of the Eastern Cape. Anyone from the Eastern Cape here? Malweni. And I've got my dear colleague here.
Hi, I'm Dr. Dadoo. I'm also a specialist dermatologist. I work in Newlands here in Cape Town. Yeah.
So we've been invited by beautiful brands from Sanex to tell you guys about something that they're launching, which is brand new. And Ahmed is going to kick away.
Yeah, so let me go. Let's start. Okay, so this is the new Sanex skin therapy range. So Sanex actually developed these 3 body washes to address 3 common concerns, or the 3 most common concerns probably when it comes to the skin, which is oily skin, itchy and dry skin, and then more dry eczema-prone skin. So they've got 3 products with 3 kind of star ingredients, which we'll go through, but also what's common to each of them. Okay, so just to make it clear, those are the 3 conditions which we're going to quickly talk about. And then I'll go into the ingredients, and Zandi will also tell you guys a bit more about why certain things were chosen. So oily skin and acne, dryness, and then more eczema and itchiness. So just, I think acne, everyone kind of knows what it is, but essentially it's an inflammatory condition of the skin, of the hair follicle and oil gland. And we know that it is extremely common. I mean, almost probably everyone in this room has had something, some form of acne, whether it was milder, even during teenage years. Some people tend to outgrow it, or as they get older, it gets worse, or it can flare at different times in life. And I think, as we're all aware, it's got a huge emotional impact on people. Whether it's mild, moderate, or severe acne, it's the way we view ourselves, the way we present ourselves to the world. So it can lead to feelings of depression and isolation, and especially in younger people who don't maybe have a good developed self-esteem or self-worth. So yeah, so just like I said, it is an inflammatory skin disease of the hair follicle and of the sebaceous gland unit, so the oil gland and the hair follicle. And then what we see is we see open and closed comedones, which are your blackheads and whiteheads, and then of course papules, red spots, pustules. Sometimes if it's really bad, of course, you can get nodules and cysts. And it likes the areas where there's more oil or oil glands, so face and kind of upper body and back. Yeah, and it can lead to pain. There obviously would be visible redness. It can lead to dyspigmentation, even once the acne is maybe under control, and sometimes long-lasting scarring. So that's, of course, what we always want to try and prevent. That's like our main goal as dermatologists. So just to kind of quickly take you through a little bit about the background, because I think it's useful to understand why we get acne. So we said it's an inflammatory disorder of the skin. There's the influence of androgen hormones, which stimulate your oil glands to produce more oil. So that's one problem. And then the oil gland and the hair follicle, they open up to the surface of the skin through a pore, what we just would call a pore, that's the opening. But that becomes blocked up sometimes with the oil and some dead skin cells, and sometimes also keratin, which is another protein your skin sometimes produces too much of in the pore. But basically that's then what is your blackhead or your whitehead that's visible. And that's not good, because if that oil gland and hair follicle unit are blocked, then you get this, well, there's no way for the oil to go to, it can't escape to the surface, so that gland or that unit kind of swells up, and as that builds up, there's a bacteria called Cutibacterium acnes, which is actually normal to have in our skin, but it enjoys that kind of low oxygen, oily environment, and as it builds up and as the oil accumulates, eventually that unit has to kind of open up. There's not anywhere for the oil and the bacteria to go to. That kind of leaks out into the surrounding tissue and into the dermis, and then your body tries to mount an immune or response or an inflammatory response to clear it, and that's when you also then get a lot of redness. And if it's really bad, it leads to cysts and nodules and that type of thing. But yeah, so blockage of the pores, I would say, leads to all of those downstream effects, and then it's the effect of the hormones, androgen hormones specifically. And then I'm going to, yeah, Sandy will take this over.
So, how many of you have had dry skin before? Hey? And some of us have had your grandmother saying, you are pache. You know? And or in Afrikaans they say, het jy droog vel? Is my Afrikaans reg? Is it reg? Het jy droog vel? So, I mean, dry skin occurs in all of us, right? You don't have to have a particular condition to have dry skin. And also, when seasons change, your skin also changes. I don't know if any of you during winter have felt your skin is a bit drier. Or you fly from Cape Town and you go north, you go to Pretoria, and all of a sudden your skin is like, it's dry. You know, so different atmosphere and different conditions can cause dry skin. But there's also other medical conditions that can cause dry skin. So not just derm conditions, but for instance, diabetics have dry skin. You know, as you grow older, as you go through menopause, your skin can be dry. So dry skin is not something that is pathological. It's something that can actually happen even if you don't have an underlying skin condition. And it's actually quite common to most people. And how many of you love putting moisturizers on? Right? I think most of us that are here at the Clicks Beauty Playground, we love our skincare, right? But there are some people that don't like to put on cream. So when there are new products that come out that are soap substitutes that actually contain ceramides and lipids that assist in actually rebuilding your epidermal barrier, it's actually something that's really, really good to have out and in your skincare routine. So one of the new products that Sanex has brought out is this new skin therapy anti-dryness. And the actual star of the show here is the hyaluronic acid, which I will elaborate on later. If we can go to the next slide.
Okay.
So itchy skin, eczema. So eczema is incredibly, incredibly common. It's a condition that is actually genetic, but it is worsened by certain factors. And obviously when the skin is dry, it almost feels like it's cracked open and allergens can actually gain entry into the skin. So if you've got to think about the skin, have you ever picked up a stick that is dry and you bend it? What happens to the stick? It breaks. So if it's been raining outside and you take up a stick and you pick up a stick and you try bend it, does it break? No, it's more pliable, right? So the skin is exactly the same. You've got to feed it moisture. So in order to add moisture into your skin, your ingredients that you use on your skin have got to be humectants. Has anyone heard the term humectant? So humectant is an ingredient that traps water into the skin. And one of the ingredients of humectant is actually your amino acid complex that Ahmed is going to talk about, and how that can work as actually trapping water into the skin. And then also in this particular one for eczema, it has got no fragrance, right? As we know, eczema skin is incredibly sensitive, so you want to use things that don't have a fragrance, that isn't going to irritate the skin. So this is a very nice slide that I've sort of put it here together for you guys, because I think this analogy really makes it easy for you to understand. So our skin is like a brick wall, where you have your skin cells being the bricks, and in between the bricks, your cement is what we call the lipid layer. It's your lipids. So your skin is meant to sit firmly like this, next to each other, and this is an impermeable epidermal barrier. So that's when you've got a strong skin barrier. But in eczema skin, your skin cells are lying loosely next to each other. So when you've got skin cells that are lying loosely next to each other, they've lost water, they've lost lipids, you get allergens that penetrate into the skin. And allergens is a very fancy name, but basically an allergen is anything that is not meant to be inside the skin, right? It's tiny, tiny particles. It can be pollen, it can be dust, it can be a bit of fluff from your clothes that gains entry into the skin and causes inflammation. So actually, when we treat eczema skin, we don't just always throw medication at patients. We actually emphasize moisture, 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 because you want to try and rebuild that epidermis. You want to put the cement back in between the bricks to try and rebuild your epidermal barrier. If you don't do that, you're gonna do a cat and mouse, and you can have a losing game. Next slide.
Okay, so we kind of mentioned this earlier, but all three of these shower or body washes have an amino acid complex, which is actually patented with Sanex. So it's got these three amino acids called glycine, taurine, and arginine. I'll explain a little bit about them in a second, but basically, just to understand what amino acids are, they're actually the building blocks of protein, and of course, throughout your body, you've got proteins, especially in your skin, hair, nails. In skincare, if they are used topically, they can help the skin to stay strong, hydrated, and kind of resilient and improve your skin barrier. Another one that's important, which is something that I think maybe people don't know about, is something called natural moisturizing factor. So that's something that is produced in your epidermis. It's actually a breakdown product of some proteins and other things in the epidermis. And then amino acids are a component of that, particularly glycine and arginine. So they're major components of the NMF. And so, yeah, overall, they play an important role in regulating the skin barrier and maintaining hydration and keeping the skin pH healthy. So let's start with glycine. So glycine is actually the smallest amino acid which is found in humans. Topically, it can improve hydration and suppleness and support barrier repair. And then it's also been shown in some settings to enhance collagen synthesis. And it's also, as I've said, a component of that NMF or natural moisturizing factor. So the next one being taurine. So taurine has also been shown to strengthen the epidermis. In fact, it makes the spaces or the junctions between your epidermal cells kind of tighter so that that wall is stronger and able to kind of protect you against outside things, irritants or bacteria or anything else. Over time, can also promote ceramide synthesis. So ceramides are lipids, and those are also necessary for a good well-functioning skin barrier that's hydrated. So they can reduce transepidermal water loss. It's also been shown to be anti-inflammatory and antioxidant. And in some settings, it's actually been shown that it can upregulate hyaluronic acid and type 3 collagen. Then lastly, we have arginine. So arginine is also another component of the natural moisturizing factor, or NMF. It also enhances hydration. It's been shown to have mild anti-inflammatory and barrier repair effects. And it can also support collagen deposition and may accelerate wound healing. And then, yeah.
Right, when it comes to oil control, have you heard this ingredient called niacinamide? Niacinamide is a vitamin B3 ingredient, so it assists in actually helping the skin function optimally. It's a superstar in several proven benefits in the skin. It also decreases pigmentation. So actually a lot of products have got niacinamide to try and fade pigmentation. How many of you think that it's easy to apply a cream on your back if you've got back acne? Right? It's difficult. How do you get there? So this actual product that has come out, I think has been brilliant from the Sanex team, because a lot of patients always complain, how do I put it there? But here you've got a shower gel that actually has niacinamide, which is an active ingredient, which is anti-inflammatory, regulates sebum, and you just put it on your scrunchie and you wash. How easy is that? Right? Next slide. And then with the dryness and the dry skin, hyaluronic acid, there are a lot of products, a lot of serums, a lot of fancy moisturizers that contain this wonder hyaluronic acid. But do you know that you actually have hyaluronic acid in your own skin? So all of us sitting here have got hyaluronic acid. It's the gel in between our collagen that makes our skin nice and plump. But as we get older, we obviously lose our hyaluronic acid and our collagen and our elastic fibers. But for instance, patients with dry skin, you need hyaluronic acid because, like I said to you, it traps water into the skin. So if you're actually using that on your skin and you wash with it, you can actually almost not need a moisturizer because you're getting that moisture and an ingredient that's active in your actual shower gel. Next one. And then the anti-itchiness. So the anti-itchiness, the star here is the omega-3. So it's healthy fat. So how many of you like natural products? You want something natural? This is natural, okay? So omega-3 actually comes from nuts, vegetables, and plant oils. So skincare, it's used for its anti-inflammatory effect, it's soothing, and then it also calms irritation. So most eczema patients complain of redness and irritation. So this is very soothing. And the omega-3 works best to be stable, and so it's a very nice compound to have in a cosmetic product. So the other product that is in this skin therapy is the bisalol. So bisalol is gentle, it's smooth. There are a lot of bum creams that actually contain bisalol. So you can imagine this is a really good ingredient to have in a shower gel. It really soothes the skin, also soothes redness and irritation, and doesn't cause any irritation. So, next slide. So I hope you guys have been listening attentively because we have got prizes. Who doesn't want a prize? I mean, really, right? Okay, so we're going to test you guys and see who's been listening. So there are a few questions. But actually, have you guys, you know, in your guys' goodie bags when you leave, you each get one of these. So you walk away with one of these in your goodie bags. But there's something very special that we're giving away. And Ahmed, you're going to ask the first question. So this is a body glove wireless speaker that you can actually use in the shower. How many of you like singing in the shower? Okay, so Ahmed, you're going to ask the first question.
Okay, so
I'll walk down and I'll head out.
going to make it relatively easy. Which ingredient do you think, let's say from the 3 kind of star ingredients that we showed you, would be good for oily skin or, okay, I think...
Okay, first the lady in the
Yeah, with the
beautiful
sparkly...
Alice band.
Is it glycine and taurine and
Yes, what, amino acid complex. Well done, yes.
Do you want to ask another or...
Okay, so when we have dry skin, what is one of the conditions that can give you dry skin? Who put their hand up first? Okay, he's picking. Take me out.
eczema?
Yes!
It was too easy.
Because I wanted them to win the prize. Any more questions? You guys have any questions about the new range, the skin therapy range from Sanex that has just been launched? Any questions? Or any skin questions then, but any questions about the brand or the new skin therapy? You can ask any of us. So the question is, can we use this for children? Absolutely. So you can definitely use this. Obviously for children, they don't really have acne yet, right? But definitely the sensitive skin as well as, the anti-dryness and the anti-itch, you can definitely use. But if you've got a child who's got eczema, you want to go really for the anti-itch. So the difference between these two, the anti-itch and the dryness, is that the dryness has a bit of a fragrance and the anti-itch doesn't. So if you've got a child with a very, very sensitive skin that doesn't tolerate fragrance, then you can definitely go for the anti-itch. Okay.
Yeah.
Any other questions?
Is there Sanex product that actually helps with body odor?
Oh, that's a brilliant question. Hey, Sanex team, is there a Sanex product that actually helps with body odor?
So all of our products actually have ingredients in them, like all have a nice smell except for the anti-itch. So if you're looking to deal with odor, I would say our normal, if you don't have any dry skin, you don't have any oil, I would say that your best option is to go with our normal Expert Skin Health range, which is available in all stores. And we've got the moisturizing variant and the Pro Hydrate variant. Both smell really nice and both deal with odor as well. That's not the main concern it deals with, but they smell really nice, so definitely they'll fight odor.
Any other questions?
Any more questions?
Guys, you've got 2 dermatologists in the house. You have no
Yeah.
questions. Come on,
Actually,
use that. Use
you
us.
don't have to
You're
pay for
here. You are here.
It can
what questions do you have?
It can be non-Sanex related as well.
Would the condition of rosacea, would it fall under acne or eczema? How would you treat it?
So I would say it's on its own because it's got a little bit of a link between everything, because with rosacea there's barrier dysfunction and we know that your skin is more sensitive, and that overlaps a little bit more with, let's say, eczema, because we know there's a similarity in that being more sensitive, you can only use certain barrier protective ingredients. But it's its own kind of entity and also requires its own treatment plan. But generally with rosacea, we always try and build up the skin barrier similarly to eczema and to use products that can maybe minimize the redness, because that's one of the big features with rosacea, of course. So I wouldn't say it's similar to, maybe more to eczema, if anything, because of the barrier dysfunction, but it's its own thing that has that redness and flushing as part of it, which is a separate problem as well. So there are products that can help with that and medications as well. But yeah, it would need to be tackled kind of separately from the other 2 conditions, although there can sometimes be unlucky patients who have acne and rosacea, which makes things difficult, yeah.
Any more questions?
No?
Yes. Don't worry. Ignore everyone. Look at me.
So with marks on your skin and everything like that, what is a good thing to use for it?
So you're talking about like pigmentation.
No, not just pigmentation, but anything else, like acne scars or anything like that too.
Okay, so that's a brilliant question. So I often get patients asking me this, oh, doctor, I look at my acne scars. So there's a difference between post-inflammatory pigmentation and acne scarring. So acne scarring is much deeper in the skin. You can either get depressed scars where they look like ice pick scars on your face. So that is true acne scarring. But if you've got pigmentation or inflammation from acne, that's not necessarily scarring. That's just pigmentation. So a lot of our dark-skinned, more chocolatey brown skin, often once you have inflammation in your skin, it often heals with pigmentation. Our lighter skin types, a lot of the pigmentation, a lot of the inflammation looks red. So that redness that you get from acne is actually not scarring. Right? So how we deal with it, acne scarring is very difficult to deal with. So you really want to target the acne when it's inflammatory and get rid of it. Once you've got scarring, then you have to do the more micro needling and all the other type of conditions. So there's no cream really that can assist with acne scarring. But a great ingredient in the skin therapy oil control is niacinamide. So a lot of products actually that we use that are for pigmentation contain niacinamide. So this is a very good ingredient to actually use even as a shower gel on your back. Because how many of you have seen people with acne who had acne and they've got spots on their backs? So this is a really good ingredient actually to use. I mean, a shower gel to use because it does have niacinamide, which is anti-inflammatory and also targets pigmentation. Did I answer your question? No, because here you've got the amino acid complex that actually helps you your natural moisturizing factor. So it doesn't have any salicylic acid or lactic acid, which are the ingredients that actually dry out your skin. So, yes, or retinol. So it's actually a very nice shower gel to use. It will still hydrate your skin, but also target the pigmentation.
Yeah, I must say all three are quite well balanced. We've used them now for the past week or so, and I find that none of them are drying or anything like that. It's quite a nice balance.
A question. So, for me personally, right? So when I get out of the shower, my skin is dry, and then I start to itch. So, which shower gel would you recommend for that? Because if I don't put lotion, and then it's game over for me, right?
I love that. It's game over for me if I don't put lotion on.
So yeah, look, so what you're saying is you don't have like full-blown eczema or you've never had that problem. Then it's, yeah. So look, I would say in the shower, try the anti-dryness because that's got the hyaluronic acid and now the amino acid complex. So that's already going to kind of cleanse you without stripping your skin of moisture. So that's already a benefit because there are some body washes, unfortunately, or even soaps and things that do unfortunately strip your skin. And then you kind of want to then moisturize or over moisturize because of that. So already from when you're in the shower stage, try and keep your skin as hydrated as possible by using these kinds of gentle cleansers or body washes that have specific ingredients.
Another tip though, if you've got very itchy skin, especially when you come out of the shower, instead of drying yourself, you actually put a moisturizer while your skin is wet. It's actually called the soak and slap, right? Soak and slap method. We say to eczema patients all the time. Because if you do that, you actually trap that water in your skin. So you literally come out of the shower, you can maybe wiggle yourself, and then you just put the moisturizer right on, and that actually locks the moisture in. Because you've got ingredients there that trap water, so use them.
Yeah. Because it's something I never really thought of, but when you have water on your skin and you leave it to dry, it evaporates. And when something evaporates, it actually leaves dryness behind, if you think about it like that. So by putting a moisturizer on, while your skin's a little bit damp, it kind of locks that hydration in and doesn't allow it to evaporate. Yeah.
Any other questions?
More questions? We
You guys
good?
good? Lovely meeting you all. Enjoy the rest of the Clicks Beauty Playground.
Thank you so much for joining us, ladies. Get home safe, and we shall
Turn
see
around
you.
now and dance, dance, dance. I just wanna have fun, clap my hands. Turn around now and dance, dance, dance. I just wanna have fun, clap my hands. Turn around now and dance, dance, dance. I just wanna have fun, clap my hands. Turn around now and dance, dance, dance.